So good afternoon, everyone.
Good afternoon, sir.
So last class we were discussing this is last class, previous class lecture, where we discussed the treatment administered to increase ventilation. So this we discussed last class, and here we discussed the 2 points: how you can increase the ventilation by positioning technique and breathing exercise. So last two lectures we discussed these two topics. So today we will discuss treatment administered to improve secretion clearance. So what are the methods to achieve the clearance, secretion clearance from the lung? So that will be today's lecture. So improve secretion clearance. So there are many techniques. So each and every technique will have we will discuss separately. So first is coughing and huffing, ACBT. You might have heard ACBT, active cycle of breathing technique, autogenic drainage, flutter device, postural drainage technique, high frequency chest compression, manual hyperventilation, positive express. So there are so many techniques are there which will clear the secretions. So today we will discuss only first point, that is coughing and huffing technique. So how will you define coughing and huffing? Forced expiration. See, coughing is a expiratory technique. Coughing is it's an expiratory maneuver, expiratory technique. Clear? But it is coughing is called as a forced expiratory technique. Clear? It is not only expiratory technique. Not only expiration occurs during coughing, but the expiration occurs forcefully. Hence, it is called forceful or forced expiratory technique. Clear? If the glottis is closed, then it is called coughing, and if glottis is open, then it is called huffing. Both the techniques are called as FET. Both the technique. It is called as an FET. FET means forced expiratory technique. So if the forced expiratory technique is performed with closed glottis, it is called cough. And if it is performed with open glottis, it is called huff. This is the difference. Okay. So types of cough. We will study the types. There are two types. One is reflex cough and voluntary cough. From the name itself, you can understand that reflex cough means involuntary cough. Clear? So opposite to voluntary is involuntary. So reflex cough is otherwise called as an involuntary cough. So there are two types: voluntary and involuntary, or reflex and voluntary cough. So what is reflex cough? Reflex, that is involuntary. Involuntary cough. It has four phases: irritation, inspiration, compression, expulsion. Okay, what is the indication for involuntary cough. Okay, okay. We will discuss that later. So involuntary cough, when the patient, listen carefully, when the patient cannot cough by his own, when the patient cannot cough by his own, what is the advantage of cough? Cough is it clears the secretion. Cough, it clears the secretion. Clear? So what is reflex cough? Reflex cough is involuntary. Matlab, he is not performing by himself. He is not performing voluntarily. Reflex cough, he is not performing voluntarily. Yeah, that is the meaning for involuntary cough. So, what is the indication of reflex cough? When the patient cannot cough by himself, or when the patient cannot clear the secretions by himself, then involuntary cough is indicated. Again, I'll repeat. If, okay, first I'll tell the difference, then I'll teach detail. So what is reflex cough? Reflex cough, it has 4 phases. 1, 2, 3, 4. Next it is voluntary cough. Voluntary cough, it has only 3 phases. So what is missing here?
Irritation.
Irritation is missing. Yes, irritation is missing. So this is the major difference between voluntary cough and reflex cough. So what is irritation? Irritation, so in voluntary cough, irritation is not present. Automatically, without irritation, he starts coughing. In voluntary cough, without irritation, patient cough, or voluntarily he clears the secretion without any irritation. Voluntarily he clears the secretion without irritation. So then what is irritation? So irritation is required to clear the secretion. In reflex cough, irritation is required to clear the secretions. In voluntary cough, irritation is not required to clear the secretion. The question is, what is irritation? Irritation is the stimulation. It is the stimulation given to the patient. There are many techniques are there. For irritation, there are many techniques. So you are giving, therapist is giving irritation to the airway, upper airway, here, to initiate the cough. That is here. In reflex cough, therapist or external stimulation. Irritation is otherwise called as it is an external stimuli. External stimuli is, or stimulation is required, which is called as irritation. So this is required to initiate the cough. Clear? So this is the difference between voluntary cough and involuntary cough, or reflex cough and voluntary cough. Are you clear? Yes? Am I audible?
Yes, sir.
Okay. So now, what is the role of physiotherapist? Physiotherapist, he improves an impaired cuff. Suppose if patient cannot cuff properly, that is in impaired cuff, physiotherapist what he does, he improves the impaired cuff. How? By counseling the patient proper cuff technique. So the physiotherapist should teach the patient proper cuff technique. Clear? So if the proper cuff technique is taught to the patient, so what is proper cuff technique? It either it increase the inspired volume or facilitate the compression, facilitate the compression force generated, or by elicit cuff reflex. This is first one, that is irritation. Elicit cuff reflex matlab irritation है, stimulation. Clear? So these are the ways physiotherapists can improve the cuff technique or improve the impaired cuff. So what he will say, the therapist will administer the treatment by either by increasing the volume inspired by the patient. He will give command. He will give proper command. Therapist will give proper command to the patient to take proper inspiration before coughing. Here, volume of inspired air is important to perform proper cough. Clear? So that the therapist should explain about this technique. Second is augmenting the compression force or eliciting the cuff reflex. So proper cuff technique. It requires patient inspire maximally. That is what I have told. Volume inspire. The more he inspire, the more secretion clearance will occur. Clear? So inspiration should be maximum. Clear? Amount of air inhaled before coughing determines the level of clearance. Again, I'll repeat. Amount of air inspired depends on the level of clearance. Clear? That is the topic what we are discussing here. Clear? To improve the secretion clearance. To improve the secretion clearance. So what is proper cuff technique? Patient inspire maximally. Glottis should be closed. This is first step. This is second step. After taking deep inspiration, during lecture you can apply on your own. You can try. What I am saying you can try during lecture. Take deep inspiration. Close the glottis. Bend forward. Bend forward. That is bear down position. What is bend forward? This is the chair and patient is sitting like this and he is bending forward and the foot is planted on the floor. Patient is bending forward. So what is the benefit of this position? This is called bear down position. Bend forward and bear down position. What is the advantage? If the patient is sitting like this, then and if the patient is bending forward, what will happen? This abdominal content will be or supported. Here, abdominal content will be here. It is supported, but in sitting position, again I'll explain. If the patient is bending forward, the abdominal content will push the diaphragm up. I think you are following what I am saying. This is imagined diaphragm. Here, when the patient is sitting forward, bending forward, the abdominal content will push the diaphragm up. Clear? So that the expiration will be maximum. Clear? If the patient is sitting straight, so the diaphragm, it is not raised. I think you are getting what I am saying. When you are sitting straight, the abdominal content are relaxed, diaphragm is relaxed, and if the patient is coughing, he cannot cough properly. But in this position, if you are bending forward, the abdominal contents are compressed and the diaphragm it slightly raises up so that the expiratory effort can be maximum. So that is the advantage of this position. Clear? So what is first step? First step is inspire maximally. Second step is close the glottis. Third is bend forward. Fourth is patient has to tighten. What are the muscles? Abdominal muscles, perineal muscles, gluteal muscles, shoulder depressor muscles. So he has to tighten all these muscles. And this is fourth. And last step is he has to cough no more than 2 times. This is very important. Patient cough no more than 2 times during each expulsive expiratory phase. Clear? So 5 steps. So this is proper technique, proper cough technique. Inspire maximally, close the glottis, bear down position, contract 4 muscles, cough no more than 2 times. Okay. So if the patient is sitting in, for example, imagine patient is sitting in high sitting. Patient is sitting in, this is a high sitting patient. Yes, patient is position is high sitting. So here the foot is not planted on the ground. Clear? So this is also wrong position for proper cuffing. Now you see here the foot is placed flat It is planted on the floor so that he can give his effort from the lower limb also. Yes. So this is proper technique. This is not proper technique, and high sitting is also not proper technique, and lying also is not the proper technique. Lying is also not proper technique for cuffing. So this is the proper position for cuffing technique. So patient had surgery, if patient had surgery, then you have to have the incisional splinting. Small pillow or pad should be given, and you should stabilize. Either patient should stabilize or therapist should stabilize the incision, and then patient should cuff. Without support, if patient is cuffing, maybe the surgical suture made damage. I am talking immediately after surgery. Any doubt till now? Yes or no?
No, sir.
Okay. So now, little more detail we will study. I have told first is inspiration. So there are phases are given. There are 4 phases. Inspiration phase, compression phase, expulsive phase. 3 phases are there. Okay. So after deep inspiration, listen carefully. Inspiration, compression, and expulsion. These are the 3 phases. So when the inspiration phase terminates, when the inspiration phase will terminate, what is the procedure I have told? First, you should take inspiration, and after taking inspiration, what he will do? He will close the glottis. He will close the glottis. This is the termination of inspiration phase. Clear? So from here to here it is called inspiration phase. So what is compression phase? Agla phase, next phase है. Compression phase. When it begins with closure of glottis. So from here, second phase starts. That is compression phase. So you can say in 2 words, 2 ways. Inspiration is stopping or terminating when glottis is closed, or inspiration or the compression will start when the glottis close. I think you are following what I am saying. Again, I will repeat. What is the termination of? I have told there are 3 phases. Inspiration phase. So patient will take inspiration and he will close the glottis. So this is first phase. That is inspiratory phase. What is second phase? Compression phase. When the compression phase begins? When the glottis close. So either you can say inspiration phase terminates, or you can say compression phase begins. Both the line are same. So now next what you are doing? What is the next phase we have discussed here? Tightening the abdominal, perineal, gluteal, shoulder depressor. All these muscles has to be contracted. Patient will try to contract these muscles. Clear? So what will happen when the patient is contracting? Gradually the pressure within the abdomen is increased. This is thorax, this is abdomen. Clear? When the patient is compressing all the abdominal muscles, perineal muscles, what will happen? The tension, what the diaphragm will slightly go up. The diaphragm will slightly go up, and what will happen? What will happen when the diaphragm is going up? Tension in thorax increases, or in other words, intrathoracic pressure increases. When you are contracting all these muscles, so this is compression phase. I am talking in compression phase. In compression phase, you are contracting all the four major muscles. Clear? So intrathoracic pressure increases. What will happen when the next phase will start? What is the next phase? Next phase is expulsive phase. Expulsive phase begins when opening of the glottis occur. So now what will happen next? Third phase is expulsion phase. So when this will happen, this is the line. What is this line? This line is where the glottis open. Clear? When the glottis is closed, compression starts. When the glottis is open, compression phase terminates. Now expulsion phase start. So what is expulsion phase? Trapped air. Okay. You see, this is lung. Clear? For what is first phase? First phase is inspiration, deep inspiration. After deep inspiration, what happened? Air has entered into the lung. Clear? Air has entered into the lung. Then what is next phase? Glottis is closed. Now what happened? Air is trapped. Clear? Now compression phase begins. Second phase begins. What happens in compression phase? The diaphragm, it goes up. Why? Because you are contracting abdominal muscles. Diaphragm is now pushed up. Diaphragm is pushed up. Now what happens? What happened to the thorax? Intrathoracic pressure increases. Clear? Already the air is trapped. One second, you please hold. Sir. Okay. So the air entered first and glottis is closed. Air entered first, glottis is closed and the pressure is increasing. Clear? Compression phase. During compression phase, pressure is increasing. Now what happened? Next phase, during compression phase, the pressure increases within the thorax. And what is the glottis is still, it is closed. So what happens? Imagine this is the secretions lodging within the airway. Secretions within the airway, imagine. Clear? Now what happened? Pressure is increased and glottis is closed. What will happen if suddenly the glottis is open? What will happen if suddenly the glottis will open? The air will rush out forcefully. Why? Because already intrathoracic pressure is high. When the glottis is open suddenly, then air will rush very fastly. So along with air, secretion will also remove. This phase is called expulsion phase. Clear? Are you clear? Yes?
Yes, sir.
Okay. Now last, I'll read this slide again. After deep inspiration, compression phase begins with closure of glottis. Intrathoracic and abdominal pressure builds. First abdominal pressure will build up. Next, intrathoracic pressure will build with contraction of all the four muscles. Perineal muscles, abdominal muscles, gluteal muscles, shoulder depressor muscles. So what will happen? The pressure is increasing. And suddenly when the glottis open, trapped air is expelled forcefully. So now, coughing with low lung volume, coughing with mid lung volume, coughing with high lung volume. So what does it mean? Coughing with low lung volume. It basically depends on inspiration. So what I have told, I have given one sentence in the beginning. Amount of air inspired depends on, sorry, the sentence is reversed. One second. Level of clearance depends on amount of air inspired. Level of clearance. What is level of clearance? Suppose if this is the airway, imagine this is alveoli, and here is your mouth. This is your mouth, and this is your last airway, alveoli. So from here to here it is called upper airway, and from here to here it is called middle airways, and here it is called smaller airway or peripheral airway. Clear? So what is this upper airway? Upper airway represent this area. Clear? And middle, what is smaller airway? Smaller airway is somewhere this area. Please check the color which I am giving. This is smaller airway. In between is what? These are the middle airways. Here. So now you see this sentence. Level of clearance, whether it is upper airway or middle airway or lower airway or peripheral airway. Level of clearance depends on amount of air inspired. During first phase, that is inspiratory phase, if you take less air, less volume of air, then it will clear one area. If you take more air or maximum inspiration, it will clear. I give the number. This is 1 and this is 2 and this is 3. Clear? If you take less inspiration before cough, that is during first phase, if the inspiration is less, it will clear airway 3, that is smaller airway. Clear? Second, if inspiration is less, it will clear smaller airway. What is smaller airway? Smaller airway is number 3. So this is 3. This area. Clear? If the inspiration is maximum, that is before coughing at the first phase, if you take deep inspiration, maximum inspiration, if you take air too much, maximum to your level, and then close your glottis, and then you give compression. You contract the abdominal muscles, perineal, all the 4 muscles, and then if you cough, which level will be cleared? It will be 1. That is upper airway. Upper airway will be cleared when the inspiration is maximum. Smaller airway or peripheral airway will be cleared when the inspiration is less. If you take inspiration in between, not too much, not too less, not too more. If you take in between and then if you are coughing, then it will clear 8, that is 2. What is 2 here? 2 is somewhere not higher, not larger airway, not smaller airway, in between. Clear? So now you read this sentence. Level of clearance, that is level of clearance that is whether it is upper airway 1, 2 or 3. Level of clearance depends on amount of air inspired. If the amount of air inspired is less, then it will clear 1. If the amount of inspiration is high, it will clear 3, that is larger airway. This is smaller airway. And if it is in between, then it will clear middle airways. So what is important from, what do you understand from this lecture? What you should understand, inspiration makes a difference in clearing the level of, that is different levels. Clear? So I will complete them by telling few points. So there are total 23 airway generations are there. Clear? Trachea is, where trachea is considered 0, and alveolar sac is considered 23 number. Clear? So this is called upper airway, this is called lower airway, this is middle airway. If you take deep inspiration, this area, if you take deep inspiration, this area will be cleared. If you take less inspiration, this area will be cleared during first phase. And these are the different airway generations. And then this is considered 0. Trachea is considered 0. Main bronchus, this is considered 2. Lobar bronchus, this is considered 3. This is 3. There are upper lobe and middle lobe. So this is going for lower lobe. And this is going for, from to here, this is going for upper lobe. Clear? What is next? Segmental bronchi. So for each and every segment, this is main bronchus. Here. And this is for upper lobe, this is for lower lobe. Clear? You just go through this slide. Clear? So as like that, there are so many generations are there. Where alveolar sac, it comes under 23rd generation. You go through this slide. I have already shared with you. So this is about cuffing technique. Clear? Cuffing and huffing. So to complete the lecture, I will go through fast. Cuffing and huffing, it is called as FET. Open glottis is huffing, closed glottis is cuffing. Types of cough: reflex, voluntary. Reflex is otherwise called involuntary cough. Difference between reflex and involuntary cough is irritation phase. All the other phases are same. What is the role of physiotherapy? Volume, amount of volume inspired, it should give command. Because only you know how much volume should be inspired. How much volume should be inspired, that you know. What should be the level of clearance, you know. You should know where the secretion is. Whether it is in upper airway or middle airway or lower airway. Accordingly, you will teach the patient. Clear? So you will teach according to the level of clearance. You will give instruction to the patient how much volume of air he should inspire. So proper cuff technique, maximum inspiration. If larger airway has to be clear. This will vary. According to the level, this will vary. Glottis should be closed, bear down position, 4 muscles should be contracting, and you should cuff only for 2 times. So I think I'm not having, okay, this point need explanation. The patient has to cuff no more than 2 times. What is the reason? Why he should not cuff more than 2 times? Because I am drawing blue heart. Or I will make half red out of red heart also. Here. Okay. So what will happen during cuffing? During compression phase, the pressure, intrathoracic pressure increases. When intrathoracic pressure is increasing, then what will happen? There will be a pressure in the heart also. Yes. Suppose imagine this is thorax. Yes. What is this? Superior vena cava and inferior vena cava. It is bringing the blood to the heart. And this is systemic circulation. Yes. From the left ventricle. Yes. So now listen carefully. When the intrathoracic pressure is increasing, what will happen? When the intrathoracic pressure is increasing, there will be the external pressure. Indirectly, there will be pressure on the heart from external, within the thorax, but it is outside the heart. Clear? So if the pressure is increasing, that is during cuff. During cuff, intrathoracic pressure is increasing. So this will hinder, or this will restrict the cardiac input. Because there is pressure from outside, blood cannot reach the right atrium. Or in other words, cardiac input is reduced during cuff. During cuff, cardiac input is reduced. So what will happen if cardiac input is reduced? If cardiac input is reduced, then cardiac output will also reduce. Cardiac output will also reduce. So what is final conclusion? During cuff, cardiac input and output is reduced. If cardiac output is reduced, here, or in the blood supply to the brain also reduces. Blood supply to the brain. If cardiac output is reduced, blood supply to the brain is reduced, and temporarily the patient will have syncope. Syncope. What is syncope? Patient will faint. Patient will get faint because of lack of oxygen to the brain. Why there is lack of oxygen? Because blood supply is reduced. So brain will receive less blood supply or reduced blood supply. Oxygen will be reduced. So patient, the cells of the brain will receive less oxygen, and for a period of time the patient will get faint. Clear? So that is called syncope. Clear? But because of cough, if patient gets syncope, then the condition is called as cough syncope. What is cough syncope? If the patient is continuously coughing more than 2 times, if the patient is continuously coughing for 1 minute, 2 minutes or 3 minutes, what will happen? The intrathoracic pressure will increase. Continuously intrathoracic pressure will increase. For a long period of cardiac input will be reduced. For a long period of cardiac output will be reduced. Because of this, brain will receive less blood supply. Brain will receive less oxygen, and patient will faint. Because of cough, if the patient faints, then the condition is called as cough syncope. So that is why you will advise the patient not to cough more than 2 times during each expulsive expiratory phase. So if your patient may think, if I cough more, then I will get cleared with the lung secretion. But this is, if the patient is doing like this, then he is deteriorating his condition more. Clear? So always you have to instruct the patient to cough not more than 2 times. So next topic we will discuss next class, active cycle of. So we have discussed only one topic today, coughing and huffing. So active cycle of breathing, monogenic drainage. One second, you hold it.